As the world reels from the impact of the coronavirus pandemic, many countries have been thrown into a recession. Citizens have also been having a hard time coping with the development as imposed restrictions and measures have changed their way of life. Many people who struggle to survive now have it worse. They have become the poorest of the poor and vulnerable in society, as they are called. They are left at the mercy of government and well-meaning individuals donating relief materials and providing palliatives to cushion the effect of a lockdown. How hard have the less privileged in Nigeria been hit by the global health crisis? This is a big question. But joining me now to discuss this is Nkechi Alibalogun, the principal consultant, CEO, Nesi Consulting Limited, and former chairperson, Nigerian Institute of Public Relations, Lagos chapter. Nkechi, it's good to have you join me right now. I know you've heard so much from how people are complaining of coping with the challenges right now. From your window, from what you have heard and your engagement with people who, especially those we call the poorest of the poor, less privileged, what is the situation with them right now?
Thank you very much for having me. Unfortunately, the less privileged is the hardest hit in this situation right now. We're not thinking of the daily workers, the people that go out daily to earn a living. We're talking of the hawkers, we're talking of the tomato seller, the bread seller, the alabarus, the mekaya, and all these people. Now, these are people that are really hard hit in this crisis. Some of them go out every day to earn just 500 naira to feed their families. And you are asking them to stay in a lockdown for 4 weeks, and nobody is providing for them. I was thinking, why couldn't our banks, for instance, okay, I know they're giving money to government, but do you know that these banks can actually make a transfer of 700 naira daily to at least 500 depositors? You know, in a month, I'm sure, in 10 days, maybe they'll spend 10 million naira. I don't think that would be too much. We are talking of women that are breastfeeding, right? We are talking of pregnant women. These people don't have a means of livelihood, and they are dying of starvation, and nobody's talking. Now, let us also look at the children. We said we are doing distant learning. Distant learning for who? Children of the elite. In the rural areas, in the villages, there are some areas, even in this Lagos, they don't have lights. And if they don't have lights, how are they going to benefit from the distant learning? We're talking of education right now. And very soon, the aggregates will be reading that, oh, some of these children are not educated. Yes, they will be educated because they don't have the means. Right now, in the past 4 weeks or over a month, they've not been going to school. And nobody's thinking of them. How are these children going to be reached? How is their education going to continue? Are we also thinking of the safety of these children? Right. The children have become, they face a lot of violence.
All right, Nkechi, in response to what to the problem you're putting forth there, we understand, at least from what the Minister of Humanitarian Affairs is saying, the same people, the poorest of the poor and all of that, are the ones that government or federal government is sending palliatives to, or the conditional cash transfers. Some people have gotten up to about 20,000, others 10,000, depending on where and what category you belong. So isn't that helping?
Now, fine, they said so, but how many people have actually received those palliatives? We have videos going on, but some states have not been reached as we speak. Why are they giving some people 20, some people 10? Why is it not the same thing? Why is it not equal to everybody? And why are they not giving it at the same time? Some states don't know anything about these palliatives. So what is government doing to reach those other people that have not gotten anything at this point? If it is getting to everybody, why are people going to the streets to protest? Why are we having yeah, sure, we'll always have miscreants. But why are we having these daily workers coming out to say, hey, you cannot keep us at home and not give us something to survive?
All
Which
right.
means that the palliatives are not getting to them.
All right, as a way of finding a solution to this, what would you recommend so that there is fairness and everyone feels the impact of what government, either the federal or state or whatever agency or corporation is assisting, so that everybody feels the impact and everybody is okay? What would you recommend?
First of all, I would recommend that there's so many things I could recommend. One, these palliatives could get to people through their banks. So the banks will be made to make these transfers to these people. There are also bodies that have these workers that belong to bodies. Let's say the motor transport workers, right? They could send their own palliatives through their associations. There are NGOs that could also help out. I don't believe in giving money to local government chairman. We know our experiences in this country. We have agencies, we have NGOs, reputable NGOs that could help these monies to get to the right people. There are a lot of Nigerians belong to different associations. Let us recognize them. The women, we have a lot of bodies that deal directly with women. All right? I have an association that deal with widows. There are ones that deal with children. So why don't we use these bodies to make sure that these monies get to these people? This is not the time to enrich anybody. We are in a crisis. Right. And so because we're in a crisis, we must recognize reputable bodies that we can trust to make sure that these things that we are giving out get to the right people.
All right, but Nkechi, when you talk about the issue of reaching Nigerians through their bank account, the average statistics show that just roughly about 40 million Nigerians have access to BVNs or have bank accounts. And when you talk about the poorest of the poor, a lot of them don't even have bank accounts. So how challenging would that be in reaching the people who actually need? Let us not say everybody doesn't need. Everyone needs assistance this time around. But when we talk about the poorest of the poor, they could be more vulnerable than those who have bank accounts.
When we do vaccines in this country, how do we reach the people? We go, it's door to door, isn't it? So for those that don't have bank accounts, we know where they are. We know the people that live in Makoko. We know the people that live in Iwaya, Ajagunle. Sorry, I may not be able to mention all of them. When we do polio vaccines in this country, we reach them. When we count people, we reach them. When we're doing voters, we reach them. So the same process, the same way we have been able to reach them in the past, why don't we use it now? Banks will reach the people that they will reach. We have our obas, don't we? We do have our obas who represent these people. They are their fathers. So why can't they say, okay, a number of these people go to the oba's palace and pick so and so? Right. You go. I mean, there are many ways we can reach these people.
Okay, we have to leave you here now. Nkechi, we must thank you so much for your passion and what you're doing to help widows and women who have need and who are vulnerable, and for the recommendations you put forth. Certainly, I know that the relevant authorities are listening and they will do or amend whatever they are doing so that they can reach the people. Thank you so much for your time on the program. We really appreciate you.